Unit 202 Introduction to Personal Development in Health, Social Care or Children's and Young People's Settings. Outcome 1. Understand what is required for competence and own work role. The specific duties and responsibilities of your job will vary depending on your role and the employer you work with. There are ways of working in care, however, that is nationally agreed. Codes of practice. You must ensure you always work to these codes of practice and national standards. Your employer must ensure that you have training and resources to safely work to these codes of practice and national standards. You also have information that is decided locally. Your job description outlines your responsibilities in the specific area you work. Codes of practice are fixed, but job descriptions may vary from one care setting to another. It is important that you know, understand, and work to the code of practice and your job description. They should be in harmony. This section is about you showing that you understand your care worker role, not only what is required of you, but also why it is important to develop yourself in your care worker role. These are the building blocks of good practice. When working in the care sector, there are a number of standards which guide work practice. The Care Standards Act 2000, published by the Secretary of State, informs the national minimum standards. Finally, and most importantly, in terms of how you carry out your work, are the national occupational standards, which apply across the whole of the UK and explain what you need to be able to do and what you need to know in order to work effectively in social care. These are the minimum service requirements for care homes and other care services providers.